So good afternoon, everybody. My name is Damien Sewick. I work with the Region 5 for Kids Pediatric Disaster Center of Excellence. And welcome to our 18 March 2026 showcase of a patient movement and load balancing toolkit for healthcare coalitions. As I mentioned, I'm Damien Sewick and I work with the Region 5 for Kids. The PIs for this particular project, of course, are Dr. Jeffrey Luck and Dr. Ron Ruffing. And at this time, I'd invite Dr. Ruffing to make some introductory remarks.
Damien, thank you. And really, I'm very excited that we have all of our participants today to join us for this particular showcase and discussion about patient movement and load balancing. You know, Region 5 for Kids has been in existence now as an ASPR-funded Center of Excellence going on 7 or close to 8 years. And during this time, we have worked closely with healthcare coalitions, trying to expand our relationships and understand the work that healthcare coalitions do because of the fact that they are a key element in the disaster preparedness and response for communities across the United States. We recognize that every healthcare coalition is unique working in their own separate environment, but this is also the local environment in which our communities will be preparing for disasters. So this is one of the reasons why we have really kind of emphasized in the work that I've done, particularly around this issue about patient movement and load balancing and why this work is so important. So I want to thank all of you for coming. Again, Region 5 works in the upper Midwest, in Minnesota, Wisconsin, Illinois, Indiana, Ohio, and Michigan. So we have our unique set of challenges. I think the weather in Michigan right now is posing a huge challenge to our friends in the upper peninsula of Michigan. So we recognize that every place is unique, and what we've tried to do with this showcase is to touch on, introduce, and help healthcare coalitions wrestle with this idea about what is the role of healthcare coalitions in patient movement, and to help people complete the obligations that they have under the HPP planning for healthcare coalitions. So again, thank you so much for joining us. And I guess that at this point, I don't know, Jeff, if you have anything you want to say about what we're doing, why don't you go ahead and introduce yourself and join in the conversation here.
Sure. Jeff Luke here. I am an EMS Model Director in Cleveland, Ohio with University Hospitals. And I think this is a wonderful opportunity for us to look at how transportation resources and hospitals will balance any surge incidents. So looking forward to the discussion.
Thank you, Jeff. Damien, back to you. Why don't we go ahead and start it?
Thank you, Dr. Ruffing. As mentioned, we are Region 5 for Kids Pediatric Disaster Center of Excellence. We are an ASPR-funded grant of 9 children's hospitals spread across the 6 states represented here. Of course, Illinois, Indiana, Michigan, Minnesota, Ohio, and Wisconsin. And of course, our mission, as always, is to develop best practices around disaster preparedness and response to improve the overall pediatric care and emergency response at local, state, and regional levels. And we really do try to advocate for the pediatric element in all the cycles of disaster preparedness and response. A little bit of etiquette for today's webinar. Number one, it is being recorded, and traditionally, the timing of Region 5 for Kids, we usually have the recordings posted within 48 hours to our website. So if you're interested in returning to it or sharing it with a coworker, the recording should be posted within a couple of days. The webinar Q&A is the preferred form to ask questions. It's the only form that's actually going to be monitored by one of our partners. If you have access to a chat, will not be monitored or responded to throughout the webinar. On the back end of the presentation, there will be a period of time where we address those questions in the Q&A as related to the toolkit. Throughout the course of the webinar, if you have a question and you see another attendee has asked that question, you can actually upvote and elevate to the priority of the question you have an interest in within this particular webinar. And throughout this presentation, there will be two opportunities where we will display a QR code that should give you direct access to the toolkit in and of itself. If you're interested in viewing and following along with the toolkit as we go through today's short presentation, have a QR code reading device available because we will display that twice throughout the next 45 minutes. Once again, Reading Five for Kids Pediatric Disaster Center of Excellence is an ASPR-funded grant. Everything we say here today is the opinions of Reading Five for Kids. Nothing we say here today is the opinions or policy of ASPR, Health and Human Services, or the federal government. This toolkit that we're presenting today, sort of adding on to the idea that our opinion, not ASPR's opinion. This toolkit being presented today is being presented as a supplement to existing ASPR resources, policies, and materials. I'm sure we're all familiar with ASPR, ASPR Tracy, and the vast library of resources available. This toolkit is being offered as but one puzzle piece within that larger mosaic of resources available. And so here's the first QR code. If you're interested in opening and reviewing the toolkit as we go through the presentation, this QR code will take you to a Region 5 for Kids exercises webpage. On that webpage will be patient movement and load balancing as the top event. If you expand the resources and presentation tab, the toolkit should be right there and available to open and follow along. I'm going to linger on this slide for a couple extra minutes, allow folks to catch up and access the QR code as they need to. And as that's happening, I want to share some information about the toolkit. As we developed the toolkit, we adopted several assumptions that helped guide the development of the toolkit. First assumption, Dr. Ruffing alluded to, just recognizing that all healthcare coalitions are unique. Unique in terms of jurisdiction, geographic size, population density, funding, local resources, and whatnot. And so with that in mind, the toolkit is developed much more of a universal approach to ideally have value to all healthcare coalitions, but recognizing that all healthcare coalitions are unique. Second assumption baked into the toolkit is the concept of we adopted the concept of the full of a healthcare coalition as a full jurisdiction. So a toolkit for the healthcare coalition, and when we say full jurisdiction, we're talking about of course, the healthcare coalition core staff in office, plus all of their community partners. Healthcare coalition, depending upon who you're talking to, could refer to just the core office or that larger concept. We adopted a larger concept for the duration and the production of this particular toolkit. A couple of variables we think separate this toolkit and make it a little bit unique from that full library of other potential resources. Number one, it is written to the concept of the full healthcare coalition. Within topics, of the various topics that are included in the ASPR Hospital Preparedness Program Cooperative Agreement, there is a pattern for a specific topic to task number one, do an evaluation. Task number two, do a plan. Task number three, do a tabletop exercise. This toolkit incorporates all those tasks into one resource versus having a standalone toolkit for each step of that particular process. When you open it up and download toolkit, you'll see that it is a Word document and it is 100% editable by the Healthcare Coalition. Healthcare Coalition can add content, delete content, customize, add logos, and then modify it to meet their local needs. 100% editable. Additionally, the toolkit as composed, it comports very closely with the language and requirements of the ASPR Hospital Preparedness Program Cooperative Agreement. As we are developing the toolkit, if there is a question of should this item be in or out, we always sort of look to the cooperative agreement as the guide for development of this particular toolkit. And what I mentioned once before, we think we propose or offer this toolkit as an additive value to existing ASPR literature and resources, not added value, not alternative. And with that, here's just a quick screenshot of the cover and the table of contents. In the next slide, we will actually open the toolkit and review these elements. I just wanted to show one large view of the table of contents, because as we scroll through the document itself, the full scope is not going to present itself as well. The toolkit in and of itself, of course, has 34 pages. Items number 1 and 2 are 2 templates for healthcare coalitions' use in meeting those cooperative agreement requirements for patient movement and load balancing. Of course, item number 1, a planning template, and table of contents, item number 2, a tabletop exercise template. The toolkit also includes one informational section about federal coordinating centers. In the cooperative agreement, ASPR very strongly recommends that healthcare coalitions that exist within the jurisdiction of a federal coordinating center, those healthcare coalitions should participate in the FCC's exercise whenever it occurs. So we added in just a little bit of additional information about the federal coordinating centers to address that requirement within a cooperative agreement. And as you can see, the toolkit in of itself has 6 additional appendices of additional resource material to help further explain or provide background information necessary for patient movement and load balancing. And with that, I'd ask your permission, I'd ask for your patience for 1 minute here while I close out this PowerPoint presentation and open the actual toolkit in and of itself, which should be right here. And if I can get a thumbs up that this is presenting well. Perfect, thank you. So as mentioned before, this is a Word document, fully editable. Everything in here, content, edit, delete, add logos throughout the document, and we will see that going further on. What I would like to do is, whoops. Just give a real quick look at, of course, the cover in and of itself. Once again, easily to change for a healthcare coalition logo or preferred photo. Table of contents, which we talked about just a minute ago. And of course, toolkit overview, sort of lead in information to help describe the toolkit in and of itself. So the purpose of the toolkit here in Region 5 for Kids, we have a very strong cooperative relationship with the 48 healthcare coalitions within our 6 states. Earlier last spring, almost a year ago now, wow, we hosted an in-person workshop for our healthcare coalitions where we addressed the topic of cybersecurity. And during that workshop, hands raised almost universally. Can you do a toolkit for extended downtime? Can you do a toolkit for patient movement load balancing? So this toolkit exists sort of at the request of our local healthcare coalitions. It is designed to address, I've said it a couple of times already, the requirements of the ASPR Hospital Preparedness Program Cooperative Agreement. Once again, that was sort of the guide as to what to include and how to format the toolkit. We propose this is not duplicate. We don't want to duplicate existing work. From the perspective of a healthcare coalition, I'm sure there's already a full slate of plans and resources developed to address components of patient movement. This particular toolkit is once again sort of that smaller puzzle piece within a larger scope of the scholarship or the materials to address those cooperative agreement requirements as it relates to patient movement and load balancing. Selective content, once again, we refer back to the cooperative agreement, in or out. Additionally, we adopted the view of a healthcare coalition. What would be potentially useful for a healthcare coalition, and use that to evaluate content, in or out. As is customary across the full sector of preparedness and response, knowledge and scholarship, it's always evolving, always changing, and the same thing applies to patient movement and load balancing. Six months from now, a year from now, there will be changes. And so we put a bit of a caveat in there that there is a bit of an expiration date on this toolkit. After this July, and anybody using the toolkit, we recommend you go back and validate all of the resources cited within the toolkit. And once again, the same funding statement we offered before. We are funded by ASPR. We are not ASPR. What we present is our opinion, not ASPR, HHS, or the federal government. And so the first item in the toolkit in and of itself is a template for planning patient movement and load balancing at the healthcare coalition level. This particular template is built upon a planning annex template common throughout the healthcare coalitions within our region, recognizing that it may look elsewhere in other healthcare coalitions. Once again, it is a fully editable Word document, and throughout the duration of the document, items that are highlighted are things that we think at a minimum a healthcare coalition would need to edit in order to make this particular template useful for the healthcare coalition. So of course, this is just a cover page for the planning template. Once again, planning template modeled upon existing templates in use throughout our Region 5 for Kids. Of course, an introduction to the planning template, concept of operations and additional considerations. And once again, the yellow content is at a minimum what we think a healthcare coalition would need to add to make the template their own. Of course, address the scope and overview, the traditional overview of the healthcare coalition, planning assumptions, and one additional feature we added into the template is sort of these helpful hints. We're guilty. We want to advocate for pediatrics. These helpful hints are just little reminders to remember the pediatric considerations as you're going through the patient movement planning and load balancing planning process. Concept of support operations. I'm sure that the audience is very familiar with. I don't want to dwell too much on the topic because I'm sure the audience is very familiar with healthcare coalition planning templates. I would call out that the gaps and the planning factors do call out all of the specific items identified in the ASPR Hospital Preparedness Program Cooperative Agreement. Another little helpful hint to think about pediatric transportation resources as you're assessing the transport resources throughout your jurisdiction. Then, of course, some additional considerations as related to situational awareness and communications. As presented, a pretty tight and concise planning template with the idea that the healthcare coalition fleshes it out to match their jurisdiction and the needs of their healthcare coalition. The second component of the toolkit is, of course, a tabletop planning template. This template is based upon the requirements of the HC exercise planning program. So once again, going to be should be very familiar to the audience. And so it is a template situation manual, and it's got all the traditional components of a situation manual. Of course, an exercise overview. We added some objectives into the template as an offering. Once again, fully editable and customizable to meet the needs of the Healthcare Coalition. Of course, the general information of a situation manual. A crosswalk between exercise objectives and the ASPR preparedness and response capabilities. Roles and responsibilities, guidelines, and all the traditional components of a tabletop situation manual. We did add in, provide space for a scenario and offered a few questions to prompt conversation, but would recommend Healthcare Coalition review, add, delete, edit at their convenience. Within the tabletop template, 2 modules, 2 rounds of injects, a potential exercise schedule, participants, the ASPR preparedness and response capabilities, and the traditional acronyms. Within our toolkits, this exercise template has appendices, and so I put this note in there that this is the end of the template. Follow-on appendices are for the overarching toolkit, not necessarily the template. But as described before, we do have one section with just some overarching information about federal coordination centers that ASPR has strongly recommended Healthcare Coalitions participate in their tabletop exercises. Information about ASPR, the NDMS Patient Movement Program. Once again, those ASPR preparedness capabilities requirements. A couple sections of the cooperative agreement, and what we're trying to do here is tie in the toolkit to the specific language of the cooperative agreement and making sure we hit all of the required components of the plan as well as the exercise. Item 4.3, that is ASPR's lean in and strong recommendation that Healthcare Coalitions participate in a local FCC exercise if one is available. Then, of course, a few additional resources. Some information related to the Great Lakes Healthcare Partnership, the Region 5 Special Pathogen Notification and Transport Request program. Our Healthcare Coalition is written, this toolkit is written for the Healthcare Coalitions within our 6 states. This is one item that we feel they need to be aware of and potentially have access to points of contact. Fully recognize that states other than our 6, that particular piece of information may be excessive. And of course, the acronyms baked into the toolkit in and of itself. And with that, I'd ask you to bear with me for one more moment again as I close out the toolkit and reopen the PowerPoint presentation. And hopefully I can get a thumbs up. This is presenting well. Perfect. And with that, that is ideally a short and dirty presentation of the toolkit, the bare bones, the highlights thereof. And I can't see the Q&A in the webinar in of itself right now, but I would assume that there's a couple questions at hand. Happy to take and answer those at this time.
Damien, there's actually one specific question other than we posted the link in the Q&A for people to access. Kat had a question regarding the HPP NOFO. It specifies that patient movement plan is a recipient level plan with the coalition's input. The toolkit is designed as a template at the HCC level, and can you please comment on how those align?
Please, can I hear the question one more time?
Yes. The HPP NOFO specifies that the patient movement plan is a recipient level plan with coalition input. This toolkit is designed as a template at the HCC level. Can you comment on how those two align?
That is a awesome question, and it kind of gets back into very early on. We recognize every healthcare coalition is different. I think this question kind of hints a little bit at the idea that every hospital preparedness program at the state level is different as well. Within Region 5 for Kids, our HPP, and this is not an absolute, but more of a standard throughout the region. At the state level, the hospital preparedness program directors push that requirement on down to the healthcare coalitions, such that in my state, particularly, a healthcare coalition will write a template and feed that up to the HPP manager who combines and submits to ASPR. I don't know if I'm answering the exact question Kat is asking, but I think I'm trying to get to potentially a different relationship between the HPP funding and the requirements, maybe a little bit different.
Okay. We also, Kat, if you want to put a response or any additional questions regarding that in the chat, we can come back to it.
Sherry, let me just add one thing. One of the
Thank you.
things that we have tried to do here is to encourage the healthcare coalitions to sit down with their various partners and go through this plan. So this is not designed, for a healthcare coalition office to sit down and fill this all in. What we really envision is this would be a starting place for discussions that would include all of the players, and I think that may get a little bit more to the question than as why we've designed this the way that it is and how it fits into the overall picture. We do recognize that healthcare coalitions in and of themselves, may not be responsible for this movement, but because they are a place for, and this again, it varies from state to state and how you set up these coalitions. It is a space, the healthcare coalitions are a space for their partners to discuss how they would do this together. When we think about large-scale disasters and where hospitals and systems are going to be overwhelmed, we have to think about how they're going to work together. And again, it is this healthcare coalition that creates a space, at least for these dialogues to take place. And that's really one of the things that this touches on. I don't know, Jeff, did you have any other thoughts about that? Any other?
Thank you, Jeff.
Yeah, go ahead.
No, I was going to say thank you. There is no additional response from Kat, but Kat, I just encourage you to reach out to us to have a more one-on-one conversation, and we would be open to answering any additional questions. There is another question/comment from Christina Fazio with the Ohio HCC Region 2. They have a NDMS exercise scheduled for August 11th, and they are also coordinating a forward movement of patients exercise that same day. They have an untested forward plan, and she was curious if anybody has a tested guidance or a tested plan that they can share.
So that is an awesome question. And I know Christina, and I know she already probably reviewed all of the resources available in ASPR Tracy. In my pocket, I don't have what she's asking for, quite honestly. And so that's a great question. Is there a tested plan available for the movement of patients, the reception at an FCC, and forward movement of patients? So we will be, if anybody has a validated plan, please share. You can send that to my email, add it to the Q&A right now, and we will make sure we share that with the full audience, should anybody have one available.
And Pat Frost was just curious as to how Christina was defining forward movement, that term. And then we have an additional question from Jesse Escobar.
I believe so. To my understanding, and of course, Christina is not available to
yeah,
on the webinar. So I think I'm going to try to channel an answer but fully recognize I may not understand the question. The defining forward movement, I think that's in relationship to the FCC as far as reception of patients at an Arrowhead or some other centralized location from out of jurisdiction, receiving those patients and then moving them forward from the FCC into the various healthcare facilities throughout the jurisdiction.
And Christina added to that the forward movement is up to the community/region. It is not assisted by the FCCs.
Perfect.
Okay. And then Jesse's question was, what is your process for writing these kinds of documents? They seem helpful and thorough.
That is another awesome question. Our process for this particular toolkit was about 9 months ago. We decided to write this toolkit within Region 5 for Kids across our various work groups and hospitals and SMEs. We recruited an awesome team of experts on patient movement and load balancing. We set about having meetings every 2 weeks to develop a proposal. About 2 months in, we recruited a panel of external subject matter experts to say, and we presented to them our plan and thoughts about a toolkit. They gave their opinions. We took those opinions to heart. And then we set about gathering resources, wrote the toolkit, several rounds of edits and changes. And then luckily we were able to publish and post the toolkit a couple of weeks ago. But it's a group effort. We created a separate standalone work group for the sole task of creating this toolkit, and it evolved, as I mentioned, over the last 9 months into what we're offering today.
Damien, the other thing there is that we listen to our partners. When we originally planned the cybersecurity, was before the HPP asked for cybersecurity. We were going to do a cybersecurity event because several children's hospitals within Region 5 had cyber events, and we wanted to review that. And as we were planning for that event, the HPP asked to healthcare coalitions came out that included cybersecurity, and then in discussions in the state of Michigan with healthcare coalition leaders, they sort of led us down this pathway of engaging with healthcare coalitions around this issue. So it really grew out of work that close working with the specific healthcare coalitions within Region 5, and with very focused on the ask from the HPP requirements. So it kind of grew out of that, but closely working with healthcare coalitions.
Perfect. Thank you, Dr. Ruffing. And Sherry, do we think we're done with the Q&As?
That concludes what's currently in the Q&A. If anybody has any additional questions, pop them in now.
Okay. And so once again, to the full audience, thank you for coming. I'd like to invite Dr. Ruffing to provide some closing comments.
Yeah, I would just like to, again, thank everybody for coming. Remember that we are Region 5 for Kids. We are advocating for kids and children and families. We recognize that healthcare coalitions, really give us an opportunity to mutually cooperate on issues. We are clearly open to discussions and helping healthcare coalitions in their work, but we understand you are links to lots of other partners in your communities, so you can think about us if you have issues that come up that are related to children or families, and we may be able to provide some other assistance. We have lots of people working in lots of different areas around pediatric expertise in the preparedness and disaster space, and we're here to help move the whole mission forward about preparedness, community preparedness, particularly with a focus on children and families. So thank you so much for joining us today. I really appreciate your time. And if we can be of assistance in the future, please look to us as you look for how to improve the care for children in your community.
Perfect.
That's
Thank
all I
you,
got to
Dr.
say.
Ruff.
Thanks so much.